Hi, I'm Lindsay. I'm going to be your nurse today and doing your physical assessment. How are you today?
Pretty good.
Good. I'm going to go ahead and ask you a set of questions, okay, just to verify you. Can you tell me your full name and your date of birth?
I'm Dustin Emmert, and I was born December 26, 2006.
Okay, and do you have any drug allergies, Dustin?
I'm allergic to penicillins, specifically penicillin.
Okay, and what is your reaction when you've had penicillin in the past?
When I was little, I had really bad rash, and I got a really high fever, and we talked to the doctor about it. He said I shouldn't take really anything with any penicillins on it just because of how bad a reaction I had.
Okay, well, we'll definitely not give you any of that today, okay? And I'll make sure to put that in your chart because I didn't notice that, okay? Mm-hmm. All right, so are you having any pain today? 0 being the pain that, no pain at all, and 10 being the worst pain you've ever felt. Any pain today?
0, no.
Okay, good. All right, so I'm going to go ahead and take your vital signs, so your blood pressure, your respiratory rate, your oxygen saturation, and your temperature, okay? So I'm going to go ahead and take your temperature. Perfect. Okay, 98.7. Perfect. Okay. And I'm going to take your blood pressure. If you can go ahead and put your right arm out. Perfect. There you go. You could just rest your arm on my leg. Thank you. Mm-hmm. Okay, perfect. 108 over 58, and that's a really good blood pressure, okay? So what school do you go to?
I go to Hillcrest Middle School.
Oh, nice. So you're going to be going into high school?
Yes.
Well, that'll be a big change for you. You excited?
Yeah, decently nervous too.
I bet. Well, you should have fun. All right, so what I'm going to do is have you go ahead and step up on the scale, okay? And about how tall are you, Dustin?
I'm about 6 feet.
Okay. All right, so she's 170 and it's at 6 feet. That's a great body weight for your height. You're very tall. Do you play any sports?
I play basketball.
Oh, excellent. I bet they'll be happy to have you. All right, so your BMI is about 23, which is excellent, okay? So I'm going to go ahead and have you just face me. And what I'm going to do is inspect all of your systems in one at a time. And if you have any questions throughout the exam, just go ahead and let me know. And a lot of times what I want to know is if what I'm doing actually causes pain, okay? So if I don't hear anything from you, then I'm assuming you're not feeling any pain, okay?
Got it.
All right, perfect. Okay. So go ahead and just look straight at me, and what I'm looking for is symmetry in her facial structures. Her eyes are nice and round. Her pupils are dilated about a 3+. Her nose is midline. Your lips look really nice. They're not chapped, no lesions. And your ears look perfectly symmetrical. Okay, perfect. And do you notice any skin rashes or anything going on that you have any concerns about on your skin?
No.
No? It looks really nice. So what I'm going to go ahead and do is real quick just check the capillary refills. And what I'm going to do is squeeze your pinky fingers and then your middle finger and watch. You can see the blood fill right back into that area after I squeeze it. That looks great. Less than 2 seconds, so that's excellent. Okay. All right, and I'm going to check your skin turgor on both hands, and that's less than 2 as well. So I noticed on your chart too that you have you've had eczema in the past. Is that correct?
Yes.
Okay. And what do you do for that?
I have a medicine that I've gotten in the past from a specialist, I think.
Okay, and it looks like it's doing pretty good today. I don't see any.
Yeah.
Perfect. That's good. Okay, so I'm going to go ahead and inspect your head, okay? And what I'm looking for is any abnormalities, okay? Do you have any pain in your head ever?
No.
On your head? No, okay. All right, so I'm gonna go ahead and just look at your scalp, okay? And what I'm looking for is any dry patches, any redness, any swelling, masses, or indentations. Okay, perfect. Everything looks really good. I don't see any. I'm also looking for any circular balding areas called alopecia, and looking for any infestations like lice, and I don't see anything. So that looks really good, okay? I'm gonna go ahead and remove my gloves now. Throw them away and clean my hands again, okay? You have any questions yet? No? Okay, good. All right, so what I'm gonna do is go ahead and test your strength of your hands, and I'm gonna have you go ahead and squeeze my fingers. Okay, squeeze as hard as you can. Okay, great. And then what I'm gonna have you do is put up your hand. I'm gonna put up my hands and you're gonna push and I'm gonna resist you, okay? And then vice versa, you resist me. Perfect, that looks really good. Okay, great. Do you have any questions? No, okay. So I'm gonna go ahead and look inside of your ears and look inside of your mouth and check all the cranial nerves, okay? So the first one is gonna be the cranial nerve 7, okay? So what I want you to go ahead and do is open up your mouth and move your jaw side to side. Okay, perfect. And then close your eyes and open your eyes. Perfect. And then go ahead and puff up your cheeks and blow the air out. And what I'm looking for is that she has no problem with that. So your facial nerve looks great, okay? And then I'm gonna go ahead and put my hand right here, 2 fingers on your chin, try to open your mouth. I'm gonna resist you. Good, so that looks really good. I'm also going to check your temporal mandibular joint. So what I'm gonna do is put my fingers right here, kind of push. Does that hurt at all? No? Okay, go ahead and open and close your jaw. And then do your jaw side to side. Perfect, that looks really very normal. Okay, and I'm gonna go ahead and look at your ears. So if you can turn to this way, excellent. Okay, so I'm gonna go ahead and just kind of pull up on your ear. Does that cause any pain? No. If I'm rubbing on, how about if I rub right in the front, right in here, does that cause any pain? No. Okay, excellent. All right, so you can go ahead and turn and face me. And I'm gonna check for your radial pulse here too. That's 68, perfect. And then I'm gonna check for your brachial pulse here. That's really strong, perfect. Okay, all right. Okay, next I'm gonna do is go ahead and palpate your sinuses, okay? So when I'm gonna use my thumbs, I'm gonna push above your eyebrows, and you tell me if that causes you any pain, okay? I'm gonna go ahead and push. No. That's your frontal sinuses and your maxillary sinuses right below your eyes. I'm gonna go ahead and push. Does that cause any pain? No. Okay, great. All right, so the next thing I'm gonna do is go ahead and check your lymph nodes. Okay, so I'm gonna use my 2 fingers and I'm gonna go ahead and push, and you let me know if any of this causes you pain. This is your pre-auricular lymph node. Does that cause any pain? Nope. Okay. And behind your ears, post-auricular lymph node? Nope. No. And then your occipital lymph node, does that cause any pain? Nope. Okay. And then your parotid? No. No. Okay. And then right here will be your jugulodiastic lymph node. Does that cause any pain? No pain. Okay. And then your submandibular? No. No. And then right under your chin, I'm just going to push right there. Submental lymph node? No. Does that cause any pain? Okay. And then right back here, I'm going to push your cervical. Superficial cervical. Does that cause any pain? Nope. Okay. And then if you can just turn your head slightly to the side, I'm going to go ahead and rub down the side right here. Does this cause any pain? Nope. Okay, this is called your deep cervical chain. And then one more back here. post cervical lymph node. Does that cause